Welcome, everyone. It is the top of the hour. So we will move through some welcome slides as people are arriving. We will be in breakouts today, so we want to make sure that everyone has the best experience. And to make certain that that happens, we want to encourage you to connect your phone to your computer. Currently, it looks as though everyone's done that, and we will cover these instructions later. But the way to be certain that your phone is connected to your computer is to hover with your cursor over the left bottom corner of Zoom. And if you see headphones, then you will need to connect your phone to your computer. So you can click the headphones, you'll see a participant ID, you will type hashtag, the number on your computer, and then hashtag again, and you will be connected. And as I said, we'll give you more instructions and we can help you if anyone has any issues when we do open breakout rooms later. We can move to the next slide, where we officially welcome you to our midpoint learning session. And Carol, I was wondering if you had any words you'd like to say.
Yes. Hi, everybody. Welcome. We're so pleased that you're here. We hope that today we create a real community, so you're learning what others are doing, what good ideas they have, and really give you some strategies to move forward on this journey of improving mental health of patients and families. We know that several people have joined at different times, sometimes because of IRB and DUA restrictions. And we are not going to recap all the calls that have gone on, but we will want to learn how we can support you in moving your work forward. So again, this is such an important topic, and we're so glad that you all are joining us today. So welcome, and back to you, Lucretia.
Thank you, Carol. We'll move to the next slide, where we will celebrate you guys. You did it. You reached the midpoint. Here are the logos for our participating teams. We really thank you so much for continuing to help support emotional support or emotional health in your families and your patients. We will move to the next slide. Think about our objectives for the day, which are to discover new ideas to test with your teams, practice small-scale testing or process mapping, you'll have a choice, and to plan improvements for the next 90 days. Of course, as Carol Lannon said, we also really want to give you some opportunities to learn a little bit more about who's participating with you this year. On the next slide, we're going to look at our global aim, just as a reminder that patients with chronic conditions and their families will receive support to promote emotional health as a routine part of excellent care. Next slide. Here we're looking at those key drivers. It is a busy time in the history of healthcare, a time in which the landscape we're working in is changing dramatically. So if your team's been a little overwhelmed and you've missed some AP calls, we've got a few tools to help remind you of the steps needed to achieve our global aim. And these include to raise awareness about the emotional impact of living with a chronic condition, identify resources and make them available, develop skills and confidence to address emotional health, and build surveillance and assessment into routine clinical processes. Later in the day, we'll actually do a little wayfinding for you to remind you in which AP call we covered what topic. So if you want to review some videos, you'll know exactly which ones to review. As we think about these key drivers that help us to achieve emotional support. Let's think about our collaborative shared aim on the following slide. By March 2024, 90% of patients with chronic conditions and their families seen by clinical teams participating in the Roadmap for Emotional Health Collaborative will have emotional health needs assessed at each visit or clinical encounter. And we're excited to show our progress. So Chanel, if we can look at the next slide, let's just celebrate that we have about 60% of our teams entering data now. The full number you can see at the beginning of this run chart with the baseline data, we have 22 teams entering data now. And then you can see the progress over time from June to October. And we are currently at 59%. Now we can see that our denominator is a little lower at almost every month. That you guys are doing a great job at entering data and as you have capacity. And congratulations, because we're right on target for that 90% aim to reach that by having about almost 60% in October. Great job. Let's look at how we're doing on the readiness checklist, because we now, thanks to our data team who are here today, thank you, Balaji and Jenny, we can see our baseline readiness checklist, which is in purple, and then our midpoint readiness checklist assessment, which is in kind of turquoise or teal. Of course, the denominator, which is listed at the top, 18 for the baseline and 6 for the midpoint data, is a little different. Nonetheless, you're beginning to see that we are making some improvements on those measures to the left: staff awareness, resource lists, crisis plans. And those are really the key drivers we've been focusing on to date. And you can see that we will have some more work to do as we continue the collaborative, but it's exciting to begin to see the differences. I'll pause and see if anyone has a question or a comment about data before we move forward. Okay. Well, then let's move forward just to help you with some logistics other than Zoom today. As a reminder, we do have a Roadmap Collaborative participant page. You can reach that with the QR code on the slide. Once you access that page, you will need to type in the passcode Roadmap 2023. And you'll find slides for today and handouts. And speaking of handouts, we're sharing one with you on the next slide. Alani Wilson has made a lovely blank slide. You'll be able to type in those green squares. If you happened to have accessed your handouts already and have this printed, you can just write under each of those stops. Again, raise awareness, identify resources, develop knowledge and confidence, and build assessment and surveillance into routine visit workflows. Okay. We have a nice number of participants with us now, and we're going to give you an opportunity to share some of your thoughts with us to let you celebrate. And before I talk through the Menti, I just want to notice Carol's chat, which is, of course, very important. And that is, we do have a couple of teams who are still waiting for DUA approval. We've said this many times. We'll say it again at the end. Please be collecting data and hold on to it so that when your DUA is approved, you'll be ready to enter data. Dayton, thank you for typing in your attendance into the chat box. If anyone else has multiple people in the room with them, We'd love to know who's with you today. Now let's think about the slide that's in front of us and find out what you are most proud of regarding your roadmap work. So you can join the Mentimeter with the QR code to the right. You can also join via a link, which, Alani, I think I actually have it. There we go. Or you can type www.menti.com into one of your devices and enter the code 69409419. This code will also show up on the Menti slide. Now, oh, look, it's great. Beautiful. Somebody is fast. Another provider besides myself finally started asking and documenting. That is really exciting. Somebody says they're asking every time. Big accomplishment. What else are you most proud of? Again, you can type in menti.com and use the code at the top of the slide. Beginning to have conversations with all patients and families, not just those over 12. Wow, I would love to know who that was, to know if you're, what kind of subspecialty practice you're in. Increase in screening amongst all providers and increase in referrals for mental health. Very exciting. Referrals. We're kind of talking about how to really have the conversations well with patients, but it's also nice to see that people are beginning to think about how do you address emotional health. Getting the word out about the importance of talking about mental health. I love that positivity. That framing is great. Beautiful. I see some smiling faces on the video cams too. Oh, even some of our non-core providers have been proactively addressing mental health screening. Great. You're spreading. Yes, awareness of the DOT phrase we came up amongst the clinic providers. Ah, that's good. I'd love to know a little more about that if someone wants to type in. Had you started the DOT phrase and we're testing with a couple of people and now other providers are joining, or what else might be going on? Automating the EMR documentation of emotional health conversations. Yes. What we're seeing in the monthly progress report is that testing documentation is one of the biggest tests we have going on. Really bringing awareness to our colleagues. Thanks, Anna, for typing that in the chat. If you'd like to type in the chat, we'd love to see that too. Normalizing the idea that mental health is something that needs to be addressed. Great. That's that first driver we talked about, raising awareness. We are asking consistently and addressing mental health with our patients, both inpatient and outpatient. Oh, that's really good. Inpatient care can be quite complex and often is a little bit of a larger hurdle when you're testing. There's a DOT phrase again, helpful to document. Each encounter, the clinical person is adding the DOT phrase we came up with, which I addressed to our social worker for additional resources. Oh, that's good. That's a nice way of thinking about how to keep your psychosocial team involved. Pressing forward with this important work despite challenges in our clinic. Oh, yes, sharing the language you use in your DOT phrase. It's good to see patients open up to the questions. That's nice. I'm looking at the chat right now. We did have some DOT phrases shared in an AP call. We'll think about which AP call that was as we move toward the end of the day. And we're going to have a little bit of sharing with DOT phrases in the process map session. And even if you decide to attend the testing small changes, you will have access to the slides and the DOT phrase. Pressing forward with this important work despite challenges in our clinic. We have seen you list a lot of challenges in your progress reports. Thank you for sharing those. We'll be talking a little more about how we want to learn more about your challenges at the end of the day. Woo, CHLA, dot phrase. Thanks for identifying yourself. I reviewed coping mechanisms and stressors and provided linkage to social worker. I will continue to follow up in future visits. That's great. It's a great way to track your conversations so you know how to follow up well with your patients and their families. Great idea. Other thoughts? Designing a dot phrase, yes. Sometimes I think it's easy to type dot phrase, talk about a dot phrase, and think, oh, yeah, this is really easy to do. And depending on our context, it may not be easy to do. You have to gain alignment among your team. You need your IT team to help you build the dot phrase often, sometimes no, but sometimes yes. And then beginning to test it and helping people build that into their workflow. Hearing from families how much they appreciate these emotional health conversations. Oh, that's lovely. We hope you're going to share some of those stories with us. We're going to give you an opportunity to share stories from your patients and families later today. So, you guys are setting the stage for a lot of the things that we're going to be doing as we move through the day. So, thank you. Any other thoughts? I hope you're really celebrating yourselves because this work is not easy. And we are thrilled that you are continuing to think about how you build emotional health support into your workflows and gain that confidence to have those conversations. Okay, I'm going to move to the next slide unless there are any other comments, questions. Carol, did you want to say anything? Okay, Chanel, I think we're good. And I think we can let Carol introduce Tyler.
Thanks. And I just want to say to the team, Shane, thank you for sharing all the things you're finding out. And we hope that that list continues to grow as this goes on. And just want to acknowledge what Lucretia said about healthcare right now is busy, and we know there's a lot going on, and we so appreciate that you're focused on this aspect of patient care. It's really my honor and privilege to introduce Tyler Sajek. And I probably didn't say your last name right, Tyler, even though I've known you for a few years. I got to know Tyler through some work that I'm doing with the cardiology networks. And Tyler was one of 4 young adults who began to develop a single ventricle patient day that would align with the network efforts that were going on. And it's been incredibly successful. Often the patients have said, I've never met anyone like me. And Tyler recently spoke at one of our cardiology network learning sessions, and he is known as a quiet guy that when he says things, it's like pearls dropping. Sorry, Tyler, but it's true. And so when he talked in front of hundreds of people, it was really powerful because he talked about the importance of addressing emotional health. And he talked about it for himself. He had hoped his sister could come to talk about family things. She had a work commitment, but after that presentation, I thought it would be great if you all heard from Tyler about what he would like to share with you about the importance of addressing emotional health in patients with chronic conditions. So Tyler, thank you very much for being with us today.
Thank you, Carol, and thank you to the Roadmap Project for having me speak today. Like Carol said, my name is Tyler Scheidock. I'm a 30-year-old with hypoplastic left heart syndrome, and I currently work for the University of Pittsburgh. And I'm getting my master's degree in education and higher education at University of Pittsburgh. I was born in Grand Rapids, Michigan. I had all three of my initial surgeries at Mott Children's Hospital in Ann Arbor, Michigan. During one of those surgeries, the team did nick the nerve to one of my vocal cords, causing me to be hoarse for most of my childhood. But I'll get more in depth on that later. Other than the heart condition and the vocal cord issue, I like to think that I lived a relatively normal childhood. I have two older siblings, a sister and a brother, and one younger sibling, a brother. I credit my older brother for a lot of the reason that I'm as active and as resilient as I am today. We grew up playing everything we could, from baseball and football to basketball and eventually tennis in high school, where we both lettered all 4 years. He would not let up an inch in anything we did together, whether it was playing sports, playing video games, or anything else that we could be competitive at, except for grades. Neither of us really valued that aspect of our childhood as much as we probably should have. We both ended up with college degrees, but neither of us is doing what we wanted to do originally when we entered the schools we did. Going back in time a bit, I played almost every sport the city or school offered until a certain point in time. Once middle school rolled around, the rec leagues were no longer an option because the schools took over that aspect of extracurriculars. I played basketball for the school's team in 7th grade, but stopped playing at an organized level after that, but not because of my heart. I played goalkeeper on the school soccer team in 7th and 8th grade. I played baseball for the school in 8th grade in my freshman year. None of these sports I stopped playing because of my heart. It was always reasons outside of my control that I decided to give them up. I did find a home on the high school tennis team, though. I went to a small school, and the tennis team was even smaller. That meant that I would get more playing time and more activity that I enjoyed during the spring. By my junior year, I decided that it was the only sport I wanted to focus my time on, and so I started playing all year long, outdoors when the weather was nice enough for it, and indoors during most of the school year. After I graduated from high school, I decided not to pursue athletics at the college level and instead focus on my education and friends I was going to make. In high school, I also did forensics and was involved in a lot of the acting type roles with that forensics team. And I was also in the band and played tuba, including a marching band with the tuba, which was an interesting experience to have during those marching days. In college, I did find a good group of friends. It was a relatively small group, especially compared to my two brothers, who are naturally more extroverted and outgoing than I am. I graduated with my degree, and I keep in touch with the friends I made in college, even though we're all in different cities across the country. Now that the overview of my life story is over, I want to focus on the mental health aspect and how and when I wish it were addressed sooner. To start, I want to say that I have been seeing a therapist for just shy of a year and a half since I made the move to Pittsburgh. I had seen a therapist for about 6 months prior to the pandemic because the job I had at the time offered 6 months free of one of the online therapy services. Some of the aspects of online therapy were nice, like the 24/7 availability, where I could message my therapist anytime with anything that was going on. But I do think it lacked any sort of personality when all you do is text someone and rarely, if ever, talk to them face to face. But growing up, I always had the sense that I was different, even though my parents tried to let me do whatever I wanted. I could never keep up physically with my peers, even at 5 years old. I just didn't have the same amount of endurance that the other kids had. Then came school. During the first week of kindergarten, I had a classmate come up to me, point at the scar on my chest, and ask why I had the scar. Now, my scar does protrude a bit. It's not nearly as noticeable as it was when I was growing up, but it's still there and still protrudes a bit from my chest. When my classmate asked what it was, I gave her the answer that I was always given. It's my scar. At that point in life, I didn't understand what it was or why it was there. In first grade, I had gotten the sense that I was being excluded from things by my peers. And I told my parents. My dad came into my class and gave a presentation on my heart. I was treated a bit better by my classmates, but the core issue wasn't fixed. I was never really bullied in school, at least by my classmates. They knew I couldn't do everything that they could, but they did try to include me when when the guys went to play football at recess or basketball during gym. I didn't really have any outstanding issues with my classmates. The one time I remember being bullied was in elementary school, probably 2nd or 3rd grade. I was at the public school playing basketball with my older brother and our neighbor. We lived a block from the public school, so if you weren't in our driveway, we were usually there. Anyway, One of the older kids from the neighborhood came to shoot hoops shortly after we did. There were enough baskets that we could play in different courts, but this older kid didn't really care. He kept trying to get us to play the game with him. None of us three wanted to play with him, and since it was a public court, we were under no obligation to. I spoke up and told him we didn't want to play with him. He heard my raspy voice and started imitating it. It got on my nerves and my brother's nerves and my neighbor's nerves. My brother and neighbor asked him to stop, and he refused and continued mocking me. After a little back and forth, we ended up leaving because it wasn't worth it. It felt good that my brother and our neighbor stood up for me, but I still didn't feel great about the whole interaction. I was still early in elementary school, not even 10, so I didn't have full grasp on why I was different. I just knew I was. My family ended up moving after I finished 4th grade to a different town. It was a few years after this move that I think would have been the perfect time to start therapy. A few weeks before I started 8th grade, I had to have a pacemaker implanted. The surgeon and his team told me and my family that I would be in the hospital for 4 days after the procedure at most. 4 days post-procedure came and went, and I was still in the hospital. A full week went by, and I was still in the hospital. 2 weeks went by, and I was still in the hospital. At this point, I started getting depressed and started losing weight. It was at this time that I think starting therapy would have been a lot of help to me. I knew enough about my heart that I could talk about with the doctors without my parents being there. I was going through a traumatic event in my life that I could have used help with. I think it would have helped me keep my motivation to get out of the hospital and my mood in a better place through the whole stay, which ended up being 3 weeks. I got home the day before 8th grade started and immediately jumped into soccer practice, even though I lost probably 10 to 15 pounds of muscle mass from doing close to nothing for 3 weeks prior. It was at this time that I knew enough about myself that therapy, even if it was once a month or once every few months, would have helped a lot. Now I'm stuck playing catch up. I'm going through 30 years of trauma, family, and relationship issues because I didn't get the help I needed earlier. I'm part of the last generation that those questions were never asked while we were growing up. I still have stuff to deal with, and I probably always will, but not getting out in front of it hasn't done me any favors. Medical care teams, no matter what the person is dealing with, whether it's a heart defect, cancer, muscle disease, diabetes, or anything else that affects us, especially as kids, needs to be talked about through mental health lens. On top of the medical team that is working to make the patient better, mental health care is healthcare, and it's vital to everyone, especially those going through medical trauma. Our mental health as patients is just as important as our physical health in relation to what we are dealing with. I appreciate the time you've given me. Thank you.
Thanks so much, Tyler. I really appreciate what you've shared. Lucretia, do we have time if anyone has a question or you to
We
ask?
do.
Yeah.
If anyone has a question or a comment or a thank you, as Drew Warman has typed in the chat. Thank you, definitely. Thank you, Tyler.
Tyler,
Thank you.
maybe when you said impact on your family, siblings, any comments about, and I know we couldn't have, your sister wasn't able to attend the learning session, but any comments about your family and thoughts?
Yeah, I mean, I think it was definitely hard for my older siblings and my parents just because they were around for all the surgeries I went through and everything else like that. I'm not so much sure my younger brother. He's currently a nurse, so he knows a lot of the intricacies of healthcare now. But growing up, I don't think he had as much knowledge of what was happening in my life. And I'm sure it took a toll on their mental health as well. But I'm not sure to what extent it was. I know I've heard stories about my older brother when I was going through the surgeries. The day of my surgery, he would always get really, like, he was a very loud person in general, but he'd always get really quiet, and he would always like do his own thing on the days of my surgeries. So I know he took it rough, but I made it through, and we all made it through. And he has a few kids of his own now, and they're all healthy, wonderful, wonderful kids. So I'm sure that helps, knowing that, they're doing well.
Thanks. One of the things we suggest with Roadmap is starting, and not even when someone is in the hospital with the pacemaker implant, but early on, just talking about how important emotional health is from the beginning. And I think that in a lot of ways is a change for how things have gone. So I appreciate you highlighting the importance of addressing it in your life and in others' lives. So thank you.
Yeah, you're welcome.
And thank you, Tyler. We appreciate your transparency and vulnerability, and you inspire us for the second leg of our journey through Roadmap. We are going to start moving to breakout rooms. We're going to meet your fellow travelers. Before I start talking through the directions, well, let me tell you this. So, first of all, you can be looking for your team's name so you know which room that you're going to move to. Secondly, I see some phone numbers that may or may not be attached to a computer. So I just want to make sure that your computer and your phone move to the same room. So if you will hover over the left lower corner of your screen, if you see a headphone there, that means that your phone is not connected to your computer. Click that headphone and look for a code. Then type in hashtag, the code that you see, hashtag again, and that will connect your phone to your computer. If you see a microphone, you're good to go. You just want to make sure that you're able to hear when you move into your breakout room. We're also here to help anyone who needs some help. So let's think about this. Once the breakout rooms are open, you will choose the room yourself. So Chanel, if you could go ahead and click one time, we're going to share an image of, oh, well, it didn't show on the slide. But the rooms are open. There you go. Thank you. At the bottom right-hand side of your screen, you should see those little 4 squares, and it says breakout rooms. And so you can find your team name on the slide and then move to the correct room. Feel free to do that anytime. I'm going to keep talking while we need to help anyone. If anyone needs help, please let us know in the chat now. But cardiology, gastroenterology, and nephrology will move to mountain trailhead, adolescent, developmental behavioral, endocrinology, hematology, rheumatology will move to the coastal boardwalk, and all others will join me in the Woodland Gate way. I'm just going to hang out one more minute because there are quite a few people who aren't assigned yet. Any questions before I leave? Okay, looks like people are moving. We'll see you in the breakout rooms. Welcome back, everyone. If you could turn on your camera or type in the chat to let us know you're back, that would be wonderful. We are now in our QI hour. I love that chat. Just one letter. That's great. Thank you, Karen. We're going to think about quality improvement tools for the next hour. Chanel, if we can move to the next slide. Again, we are going to be in breakouts, so we want to make sure that everyone's phone is connected to the video. I think that's the case right now. If not, just reach out to us. I could see Chanel working to get everyone in a breakout room at the last session we were here. Oh, thanks everyone for typing in that you're back. That's great. But again, to think about connecting your phone to your computer, just hover over the left corner where you'll find your participant ID. Let's move to the next slide. We did cover the model for improvement in June, and we're going to do a little deeper dive with two choices today, either process mapping or small scale testing. Next slide. As I said, we went over the model for improvement in June if you want to watch that recording. But as a quick reminder, the model for improvement is a great way of trial and learning where you plan, test, and evaluate your ideas for improving processes. And you can move ideas to action. Next slide. The model includes 3 fundamental questions as well as a cycle. And rather than talk through that for all of you, we're going to have a little quiz. So Chanel, if I could share, we're going to do Menti again. And you have the option of typing in menti.com with the code 54916744, or use the QR code. The code will be at the top of every slide. I see one person joined. I'm going to go ahead and move to the next slide because we're going to have, oh, look at this, 12 players ready with all your fun icons. I hope your alter ego really fits your personality. 16 players ready. And the number of players slows down a little bit. We'll think about starting the quiz. Ooh, here come some more players. And for anybody who's joined late, there is not joined late, joined us, just joined us. We know you have clinical responsibilities. Here's the QR code. Otherwise, you can type in menti.com. The code is in the left corner. It will always be at the top of the slide. Oh, the hamburger. It's one of my favorites. Okay. You can keep joining. I'm going to press enter for us to begin. All correct answers give the max points. This team will increase emotional health assessment from 20 to 60% by April 30th, 2024. This is an example of name, data, change idea, or test. Got 10 seconds left, and speed counts. Okay, look at this. Everyone got the answer correct. It is an aim. And let's see who's in the lead. Oh my goodness, everybody got it right. So who was the fastest? You were all fast. Like we don't have a leader right now. This is a tough competition. Oh my goodness, I think I'm sweating. Let's look at your next question. Oh, got 26 people ready. 27 ready. Okay. Answer fast. What is the birthstone for the month of November? Diamond, alexandrite, topaz, or ruby? Carol, you must be the hamburger. Okay, we do have a spread this time, but most people got the answer correct. Okay, 27 people ready, 28. Okay. I'm not going to show you a leaderboard every time. One provider starts NAPC discussion with one patient in Monday's clinic and studies what is learned in that discussion. Is that an aim? data, change idea, or attest? Okay. Have a little bit of a spread again, but most people got the answer correct. Let's see what our leaderboard looks like. Do we have anybody? Oh, Simba by Just a Nose is leading. Might have to ask you who's who at the end. Question 4 of 6, 27 teams. We had 27 players. We had 28 last time. Oh, there that player is. Okay. A run chart that displays the monthly percentage of encounters in which emotional health is assessed. Is this an example of an aim, data, change idea, or test? Again, we're making it a little bit easy today because we want you to have a little fun. Decompress a little. 3 seconds left. Okay, all answers were correct. Let's see. Well, we've got 27 players. Is that 28th player here? Maybe not. Okay. In the US, Thanksgiving is celebrated on which Thursday in November? Oh, this one should be easy too. But maybe not. Oh, yes. I'm glad other people get confused about this. All right, last question. Providers are discussing emotional health, but there's nothing in the chart. They're adding a dot phrase to the EHR. Is this an aim, data, change idea, or a test? And we have some variation in answers. And let's check who has won. Simba by a nose. Anybody want to declare themselves as Simba?
That's me.
Well, congratulations, Simba. Is Simba a good symbol for you?
I like the Lion King, so why not?
Great. Hey, Chanel, I'll let you share the slides, which will help us decide about moving into rooms. So as we mentioned, you're going to choose your path, and you will be choosing which room you want to go into when the breakout rooms open. You can decide to come to process maps, in which the UNC sickle cell disease team will talk about their process map and everything they're learning. It'll be our more advanced class of the day. Or you can move into our small scale testing, and Carol's going to do a deep dive into the model for improvement, as well as talk about small scale tests and how to get started with those. So choose your room. If anybody needs help, let us know. It is at the bottom of the hour, and it's time for us to start. So if you will, again, either turn on your camera or type in the chat that you are here, that would be great. I love it when the chats come through like that. And I see some people on camera. Thank you, everyone. Chanel, let's move to the next slide. We are welcoming you back to what will be our final time together, a little longer this time, for the day. We're excited that we're going to have another opportunity for some small sharing. And then we're going to give you some time to work. And then we're going to kind of wrap up the day thinking about what we've learned and what our next steps are. Again, this shows you how to connect your phone to your computer. I think everybody's got that down now. So let's move to the next slide. This time, Zoom is going to place us into rooms. So you will see an invite that looks similar to the one that is now on the screen. And our rooms will close at 2. You'll see we're keeping up the theme that Carol and Ilani will still be in that mountain theme. They'll be at the pinnacle, at the mountaintop. Lori and Bridget will actually have arrived at the beach. They'll be off the boardwalk, but on the beach. And Drew and I will not just be starting the trail, but we'll be in the middle of the redwood forest. So we can open the rooms. Thank you all for those discussions. I don't know if anyone wants to just quickly share anything they heard in their room. I can tell you that in the woods, as I've been saying in our the roadmap team's chats, while we're in the woods, we've been having great discussions. We had so many wonderful stories that remind us how important it is to think about families and think about how our screening tool can make people feel overwhelmed in and of themselves, and really leaning into people's strengths when we're wanting to help them with resources. Yes, Carol.
We had, I just am so appreciative of people who shared. And one of the things that I took away is the patient stories helped the patients, and this way roadmap is helping the clinicians. It's when they get positive feedback, it's helping the social workers. It was really all the ripple effects that doing this work have on those who are caring for patients was really helpful. So to hear about, and I think can be helpful when you have sometimes colleagues who are maybe a little cautious about this because they don't know how to do it. Anyway, it was a great breakout group, and I want to thank everybody in there.
Yeah, we also shared a variety of stories, and one of the, I think, take homes for us was just remembering to ask families, even if they appear like everything is going fine and that they're doing well, the importance of that, and what you may find out once you ask about emotional health and what it can lead to. So it was just great hearing a variety of different stories. And then also how, being able to spread things to our colleagues too, and give them the confidence to understand that listening itself is just an intervention, but an important and key intervention. Thanks to everyone in all the groups for sharing.
Very moving, very inspirational, and also great stories to drive improvement, bring awareness to your entire team. I know that Chanel's sharing slides. So we are going to be thinking about time for you to think about 90-day plans. And we have some instructions if you're by yourself, and we have some instructions for if you're with your team. And Chanel, since you are sharing slides, can you move? Okay, thank you. Again, as we said at the very beginning of the day, we will be reminding you again of where we've been, where we're going. So again, we just had a great storytelling session, which helped us raise awareness. And that is the second bullet point under raise awareness: highlight challenges for patients with data and with patient stories. So think about some ideas you heard in those stories, because even though they were patient stories, or maybe I shouldn't say even, but because they were patient stories, lots of change ideas were in those stories. Then our second point is to identify resources. And you've done a lot of great work on that. In the room I was in, we heard another idea for resources, which is to think about college and university resources for emotional health treatment and counseling. And that was a great idea. So thinking outside the box, being creative about how to protect your patient's confidentiality as you're thinking about resources. Developing knowledge and confidence. We've had some time today to think about small scale testing and process maps, and how to fit that into our context, as well as, again, thinking about those patient stories and how they really open up your mind. Yeah, I need to do this. And then finally, building assessment and surveillance into routine visit workflows. Let's go to the next slide and just remind everybody, if you need a review of any topic, I'm not going to talk through this, but we have got this in almost every AP call, or at least the last 3 and today, that kind of helps you if you're going, okay, like I really need some more information about resources. Then you can look in that top left corner and say, okay, well, we heard about that in the essential items for the journey in the May learning session. Then we also heard about it in July and September and October, so that you can find that place where I need to get caught up. Or again, as we said, we understand what's going on in healthcare and it's very chaotic. And maybe you've missed some AP calls and you can say, oh, I missed July. What did I miss? Do I want to go and listen to that recording and review the slides? And you can see what was covered in July, which happened to be developing a resource list and starting the conversation. So those are things that are there for you if you need that review. We're going to look at the next slide and we're going to start thinking ahead. We are wanting to schedule some one-on-one time with you. You are all in different places. Some of you haven't gotten your DUA and IRB completed, although you're so close. And so we want to make sure you're prepared for the next 6 months to be successful and have your data and have enough data for your MOC Part 4 application. There are some of you who have been entering data for a while, and we just want to help you think through, like, where are you going next? We want to learn about your barriers and help you think about ways to overcome that. Maybe you'll give us some ideas for some good upcoming AP call topics. And Chanel's been doing a lot of great work on this platform called Calendly. And you will, when you're in your individual or group time, you will have the link to this. Please note that it is in Eastern time, but that you can easily change it to your time zone. And Chanel has included an arrow there and then a screenshot of how you can change your time zone so that you can schedule your meeting with us, because we want to learn from you and we want to learn how to help you. Let's move to the next slide. And this is your list of things to do. You have been going into breakout rooms all day, so you should be pros, but you will be able to see a list of every individual team. If by some chance, so maybe a couple of Atrium's teams want to meet together, just be chatting to each other right now and say, let's go into room whatever, or our first room. So like Children's of Alabama has 2 teams, but I think they're really working close together. So they may be one of those teams that says, I want to be in a single room. And as you're moving into your rooms, you can ask for help. We do have a symbol for that. That should come up on the right lower corner. Yeah. So you will have to move all the way over this is when you're your breakout room, and you'll see that little ... You'll click that and it'll say ask for help or ask for the host. And so you can do that if you're in your room and you'd like for one of us to join you. So just quickly reviewing your instructions. If you're in a group with your team, think about your 90-day plan. You've got that roadmap pathway handout. Maybe you've been taking notes on that. Maybe you'd like to organize your ideas on that. So we've mentioned schedule your one-on-one meeting with the roadmap team. And then also think about your plan for data entry. If there's something you want to improve, or you need to get started, those kind of things. And then for individuals, if you're by yourself, there's still things you can do. Compose an email to your team. Develop an agenda for your next team meeting. Again, there's that schedule a one-on-one meeting. And also think about your plan for data entry. I think we are ready for you to move into your breakouts. So you can find your room. It's a very long list. And as it may not be true for you guys, but on our side, as the rooms start to fill up, the join button moves. It was really hard for me to get in the right room last time. I see Cornell's got people moving. Stanford's got people moving. Yeah, even if you're by yourself, you can move into that room where it'll be quiet and you can get some roadmap work done.
Hi, we had a couple of questions. So Talia asked me, the first one, when you talk about the one-on-one, so I'm from Atrium, and I'm the central place for Atrium.
Yes.
Are you thinking that you want to have a one-on-one meeting with each of those separate Atrium teams, or did you want to come to our internal call series that has hopefully representation by at least one person from all of the teams in a single spot?
Sarah, I love that idea. And are the challenges and solutions similar enough across all your teams that would be useful to them all?
So you're going to be sharing that, you're going to be talking about their challenges and solutions?
We want what we're going to be asking. We're going to be talking a little bit about data so we did have plans to share. This is where you are with data. Where do you think about moving forward? So there'll be a little data sharing and learning about that. There also will be asking about what are your current barriers, and then what are your successes, so we can help you develop a plan for moving forward. Hearing that, what are your thoughts about individual versus a large meeting?
Trying to think back to what we've done. So we've only done it 3 times. The first time, like, they came out in droves. So we talked about the big picture of how we were going to move forward. I think we may have done it 4 times. The second time, then we had a long discussion about dot phrases and how we could share that information. That would have been really helpful for you. It was the kind of thing you're looking for. And then it kind of became just our QI coaches from CAPE who were joining. We didn't have a lot of participation from the team. A whole lot didn't get accomplished on that call. And then we spent the last one mapping out what we were going to use for our headlines and our patient stories for everybody. Again, we had a couple of people, clinical people, but mostly it was the QI coaches who came. So I think it's an efficient way to do it, and it's a good way to get a lot of that information shared widely. I'm just a little nervous about whether we're going to have the turnout that you want, but at the same time, I think you might have an easier time getting people in that one venue than trying to pin so many different groups down. For the appointment itself.
Here's what we can do. We're going to practice what we preached. Let's test the meeting, us joining your meeting. Of course, we also have to make sure we're available. But if that works, let's test that. And then if we think if a team or two wants an individual one-on-one, we could do it that way.
So we do it. I have to think. We had it on an every other month schedule. The next one might be Christmas week because we did it in October. Let me check and find out when the next one is, and I will email that to you.
Okay.
As the first starting. Then the other question Talia had, and it sounds like maybe you're going to do this at the one-on-one meeting. She was wondering if you guys are going to give back run charts that show. We don't know what each team is submitting for data. So when you guys shared that little bit of information at the beginning of this session, that was the first we knew. We were just wondering if there's any kind of feedback, but it sounds like you're planning to share that in these one-on-ones.
We can. And Yes, our data team, which I think they're still on the line, and gave us our first small multiples last month. We have not asked for them yet this month, but we can definitely do that, and um, we will be sharing them in the one-on-ones. And if people are interested, we can think about how to send those out going forward. Mhm.
Okay, good.
Yeah.
Thank you. Let me go tell Tanya that and then check in with my other kings.
Yeah, and we have a lot of scheduling time the week of, oh, I'm in November. Maybe I'm wrong. Yeah, we'll see if we're available that week of Christmas.
Let me, I am thinking if it is the week of Christmas, we'll probably cancel it. Okay, yeah, it's the Wednesday after Christmas. So I think we will probably cancel that one. So our next one will be February. That's too late for you?
We were really hoping, because this is the 6th month and we will end data collection in May. I think it's better if we could do it earlier to be able to help you. And Carol, what were your thoughts?
No, I think February's, Sarah, even though it's probably more convenient, and I know scheduling over this next period, I wonder if maybe giving a 2 or 3 times and seeing who can show up for, maybe there's 2 calls that are done or something. Sarah, what do you think might be feasible for people?
Laura and see what she wants to do. She's traveling this week, but she gets back on Friday. Let me see what she wants to do. Just because it's what I don't know if you heard the whole conversation, but we have a standing series every other month, and it's new the last day of the month. So, because we have 5 teams. If you're gonna have 2 calls, maybe you just want to schedule it on your time and try to put a couple of our people together instead of trying to piggyback on our ride. Let me talk to Laura.
Yeah, and see when people might be. By the way, Karen shared a really powerful story from the dialysis group in the breakout. It was great about how this has changed how people are doing things. So that was great to hear.
Yeah. They're doing incredible work in that.
Yeah, I was really impressed with it. And I'm trying to and also, what's happening with the EPIC reports. I know there's interest from some of the others who were on an earlier call this morning with that. So thank you.
Okay.
Thanks for being a coordinator. Excellent, par excellence, however you say that. So thank you.
I like herding cats, but I'm trying.
I know. Yeah, we just wanted to, I think, it's both learning from you all and then being able to look at what's going on and, just help things get far along. So that'll be great. Thank you.
Absolutely. I'll check into it and I'll get back to you guys.
Sure. Thanks. Say hi to Laura.
I will.
Welcome back, everyone. We'd love to hear a little bit about what you were doing in your work time. So if you have an idea you'd love to share about what you're going to do next, we would love to hear it. I'm getting a message about, or some messages about scheduling one-on-ones once teams are able to coordinate their schedules. So that's exciting. We can't wait to meet with you and learn more about you individually.
Hi, Lucretia. This is Megan. And our breakout room, we talked a little bit about, so we have 2 main providers doing this work in our hematology department. And so we feel like we're a little bit in a holding pattern because all of that work has fallen onto the other provider. So I feel like they're doing it, but I feel like we could maximize the work that they're doing. So one of the things that we are interested in doing is really looking at the process flow once they're back, and hoping to schedule that one-on-one once she's back and can participate as well.
Nice to take what you learned today, that process flow, and think about how to maximize that. I love that Sarah Brown was using her individual time well, and thinking about the PDSA template.
Just speaking of the PDSA template, Chanel or Bridget or Lucretia, do we have something we can share? I used a slide of that, but Sarah, I don't know if maybe we can put that on the collaborative website so people can download it. Sarah Brown, would that be helpful?
That would be great. Yes, because I imagine just looking for it on your website or just Googling some kind of template, but that would be wonderful. Thank you.
And we can email it to you as well and then put it on there. So we'll do.
Okay, perfect. Thank you.
Sarah, when we meet with you, we might ask you what your favorite template is, because there's a lot of them out there. We could use that Word version, which, by the way, what we have now is not as elegant as the one that Carol shared. So has a lot more details on it. Or we can share the circular template, where you could type in, in some ways I almost like that one the best. So we might just share both. What are your thoughts about that? Okay, good. We want to make it practical for you. If you like a more detailed Word template, you could use that. Otherwise, you can use the quote circle template, where you can just type in your plan, do, study, and act. Other ideas we're hearing about: process mapping, PDSA templates, creating agendas, scheduling the meetings. Was there anyone who thought about showcasing a patient story? Anybody have any ideas about how they're going to do that they'd like to share with us? I know we probably made you tired, and I also know that you shared really great things in the breakout so far today. So I'd love to hear anything else you discovered as you were working alone or together with your team.
I wonder if I could call on Simba, also known as Kaveh, from Duke, and ask Kaveh, you mentioned, oops, did he drop off? Maybe he did.
I'm here.
Oh, you're here. There you go. You were talking about some things about trying to think about spread, I think, and I thought in one of the sessions you mentioned how you'd focused on some of the more, I don't remember the word you used, maybe high risk, where people were seeing more high risk patients and would be open to this. So I just wondered what you were thinking about some next steps. And I might have the wording wrong, so sorry about that.
No, it's not. There's not really like one right way to describe this. But basically, I think like probably a lot of folks, we encountered kind of a diversity of opinion about the need for screening, the comfort with screening, et cetera, in our division, which is totally fair. And so we're trying to figure out like, well, how can we make progress, but at the same time do it in a way that doesn't, feel like we're pushing people past what they're ready to do. So one of the things that's nice about our site, our division at our site, is that we have a fair number of disease-specific like specialty clinics in rheumatology, and I'm involved in co-directing both the lupus clinic as well as the dermatomyositis clinic. And so my partners in both of those clinics are also very bought into mental health screening. And we know from studies that other folks have done, and then some work that we've done, that that if you do administer screeners, there's like high rates of positive results and probably a lot of need. So we felt like that was a defensible case to maybe start there, since providers are all bought in, patients probably really do need this. I think in terms of next steps, so what we have already done, we had a number of really good meetings in terms of just trying to get a sense of like what screeners we'll use, and we're most likely going to start with PHQ-9 and GAD-7, which does limit the age range that we can screen. But again, we felt like being very targeted and narrow almost at first, and just like really proving that you can do it in a subset before you roll things out is probably the way to go, just because there are younger patients that'll need other screeners, and that increases the complexity for our staff in terms of administering the right thing at the right time. But yeah, like basically we've got, I think, consensus around that. Sheila, who's I hope still on here, like deserves a shout out for collating tons of resources. I'll give a shout out to Elise at UNC, who's shared like dot phrases that she has already piloted in their screening efforts that we're hoping to adapt for our use. So I think we've got a lot ready to go. The part that we're waiting on is honestly our data transfer agreement, which that's like a whole other thing, but we don't need to get into it. And so once that is hopefully approved, gosh, I hope really soon, like then we'll be able to enter baseline data, which at this point is most of this year. And then, and then I think we'll at that point also feel ready to finalize our algorithm for responding to screening results and implementing. So it's moving. I just think like there's like this sort of go, no go piece with regards to the DTA. And then once that's done, we can like hopefully pick up the pace again.
That's great. Thanks for letting me call on you and mention that. I hope that your Duke legal team doesn't know I'm a Tar Heel fan and that that's impeding anything with the DUA. We'll hope not. But the other thing I was going to mention that, and you might have been in one of the breakouts with me, but how wrapping around some of the roadmap strategies, some of the words that Erica Sood has shared, to wrap that around some of the screening so that it's people begin to see talking about emotional health is normal, even if you're not screening someone, but just being able to bring it up. So, but I think what you're doing is great. And thanks, a shout out to Sheila and Elise. Thank you for sharing as you usually do. So thanks.
Some great thoughts. By the way, when you're this actually aligns with process mapping and small scale testing. When you're starting a new process, it is a great idea to start with a subset. It allows you to test in a smaller population, and it's part of those steps in process mapping to really design your process. If you can work out kinks and barriers with that small group. So don't ever feel bad about doing that. That's just a great way to learn and improve. Any other thoughts about next steps?
Another shout out to you, Sheila. Yeah.
Okay. Well, no, I'm not going to say that because it won't happen. Okay. Do you need MOC? Or in other words, do you need some badges? As we've mentioned before, MOC Part 2 is awarded by the American Board of Pediatrics. MOC Part 4 is awarded by Cincinnati Children's. One of their requirements is that you have data collection of at least 6 months. This is really important for anyone who just got their DUA or IRB or still needs it. Your data collection is really going to need to start in December if you haven't already done it, because REDCap closes in May. This is really important. That's part of why we want to have one-on-ones to help you decide what you need to do to make sure you have those 6 months. And then, of course, you need to be testing. You need to have PDSAs and PDSA submissions. You're actually doing that in it. If you are doing data collection in your monthly data survey, when we ask you questions about what are your successes, what are your barriers, and what are you testing this month. So that will meet that requirement for MOC. And I'll pause there to see if anyone has questions. Thank you, Carol. Cincinnati Children's is awarding the MOC credit, Part 4 credit, because it is a portfolio sponsor.
And you can also, this may be helpful for engaging others. So if you are the lead for this project at your center, if others are participating, you can also designate that they also would be eligible for this. So, and we can follow up with you about some of those, the ways to do that. But it's a way to help more people be involved in testing and learning about the data and thinking about it. And so you can be sort of the team lead that is helping do that, which I think can be motivating sometime for others.
Okay. A final slide for the day. Chanel, we can, yeah, there we go. So there will be action period calls in December. Instead, as we've mentioned, we're scheduling one-on-one sessions with you all. So you'll be scheduling with us. That we do plan those for November and December, and we can consider some January calls. Yes, thank you, Carol. So there was a question about other people joining and getting MOC. So yes. Again, we've given you a demonstration of the link to schedule with Calendly. So we'll be sending official invites as you schedule. I think we've got 4 people who've already scheduled. Woohoo! Even though we are not having a call in December, you want to give us data if you can, so you can get your MOC, and those deadlines are November 30th and December 29th. So note that November 30th is not the last day of the month, which is the typical deadline. It is the Thursday after Thanksgiving. And then, of course, we want to see you back in January. So the January action periods are January 10th and January 18th. We'll be deciding on the topic really based on largely on what we've learned from you today. And as you look at slides, you'll be able to register on the links that are on the slide. Does anybody have questions or anything else they'd like to say? I just want to say thank you. It's been very interactive. We've learned a lot from you today, and we appreciate you coming prepared to talk with everyone.
And I want to second that or third that. And just with the comment that came in, Alana, one of the things that's a little different than, I know in some of the networks, you're collecting data for the whole, hospital unit. But I think if you're sharing data, if they can be looking at some data, not necessarily all 10 charts, but that they're actually testing some things and being involved and thinking about that with you, I think that can be really helpful. So thanks.
Yes, Lori, the headlines were great. I haven't looked at them all yet. I have to admit, while you guys were working OS 2, I was downloading the Menti, and I didn't read the headlines. I was just doing the work. So I can't wait to actually sit and process them. Hey, Well, thank you again, and we will see you in 2024. Well, some of us will see you sooner in one-on-one.
That's right. So thanks so much, everybody, for all you're doing and all the difference you're making for patients and families and your colleagues. It's really wonderful. So thank you.